So let's just start with this question. What do you say to people who believe masks in schools are not going to help with the pandemic?
I'm very concerned about what we're seeing right now when it comes to our cases across the entire state and the country, quite frankly. We know that at least 99% of new cases over the past couple of months are the Delta variant, which is more easily transmitted and likely causes more severe illness. There's no question that masks work to prevent the spread of the Delta variant and previous variants as well. So masks absolutely work. We use it in a hospital setting all the time. And so they're an important piece of how we're going to prevent spread of COVID-19.
So talk to me about why MDHHS, the governor, hasn't issued a statewide mask mandate for schools. It's kind of left up to the county level.
We have put out very clear and strong guidance from MDHHS about what we need our schools to do. The schools know how to do this. We have more than 135 school districts that actually do have mask mandates in place, and we've more than tripled how many school districts have done that even in the past week or so. So we know that these decisions and this work is happening at a local level, and we commend our local health departments and our school districts that are absolutely protecting our children and our staff. And we will continue to support those at the local level in doing this important work.
But why is it kept at the local level and not something that MDHHS is looking at from a statewide perspective at this point?
We continue to look at the data when it comes to our cases and hospitalizations and deaths. The CDC, even in their guidance, they have said that these pandemic responses do need to be done at a state and local level. We work very closely with our local health department. So we will continue to monitor the data. And I'm very pleased with what I'm seeing as far as every week, more and more school districts putting in place the right measures to protect students and staff.
Mm-hmm. I probably have seen the coverage. I don't know if you have the news, but we've had these large commission meetings yesterday in Kent County, a couple days ago in Ottawa County, where parents are particularly angry about mask mandates in school coming from the county health departments. What is your reaction to seeing that and seeing so many parents upset about it?
I'm a parent as well of 3 children. I certainly understand how everyone is just frustrated and tired of this pandemic. But the good thing is we actually know the tools that we have in our toolbox to prevent the spread of COVID-19 and, quite frankly, to end the pandemic as quickly as possible. Of course, vaccinations are very, very important. Everyone over the age of 12 who is eligible to be vaccinated should be vaccinated. And then in our schools, a simple cloth mask can absolutely not just help prevent the spread of the virus, but it can also help just keep kids in school so they don't have to quarantine and, of course, isolate if they're sick. So masks, they're just a part of life. That's something that we all need to do right now. And my children wear masks as well.
I think a lot of people, again, I was at this meeting for 7 hours yesterday. Some of the things that we were hearing that people weren't concerned about their kids getting or spreading the virus. Can you kind of talk about the importance of that not happening and, kind of encourage people that, this is a serious thing?
Yes, that's really important. So we are actually seeing increases in cases amongst all age groups, and that includes age 0 to 12, those who are unable to be vaccinated right now. So we're absolutely seeing increases in that age group. We're seeing increases in hospitalizations as well in that age group. So kids can get COVID-19, they can spread it to others. Kids are certainly less likely to get as severely ill as older people, but they can still get severely ill. And we've seen increases in multi-system inflammatory syndrome in children, MIS-C as well, in Michigan and across the entire country. So it's really important people understand that kids can get and spread COVID-19.
Let's talk about that with the powers of the local health government or local health departments. One of the things that a lot of people, again, talked about yesterday is that they think the health department had too much power for being an unelected body. Why is it that the health departments have these powers to make mandates such as, or create these orders such as mask mandates, and why is that in place? Could it change?
Well, local health officers do, by the public health code, have to have certain experience and training to be in their positions. And so they are very qualified. They understand public health. They understand disease outbreaks. These rules have actually been in place for some time. And quite frankly, for schools and other places, when there are outbreaks of other viruses and diseases, our public health departments have been fighting those for decades. So it's actually nothing that is new. And I certainly would want someone with public health expertise to be making those decisions for my family and my community.
Talk to me about one question I've just been wondering too. Do you think at this point we can get control over the pandemic and control over the Delta variant, especially as we head into some of these cooler months?
Yeah, I'm certainly very concerned about the current trajectory of cases and hospitalizations. But what's really important and why I am optimistic is that we do have vaccines that are very, very effective, even against the Delta variant. And our cases, hospitalizations, and deaths are by and large in people who are unvaccinated. So we have a really important tool that works, and that's why I'm optimistic, and that's why we are working so hard to make sure vaccines are accessible across the entire state.
What can we do about vaccine hesitancy? There is such a large population of people that absolutely flat out refuse to get the vaccine. What is that like for you to hear, knowing, what it can do in the pandemic? And then also, how is there a chance? Can we convince some of these people, or what's the tactic there?
Yeah, so we've been working on this since the vaccination effort began in December of 2020. We always knew that there would be people who would be hesitant, but quite frankly, a lot of those people who had questions about the vaccine have since gotten their questions answered and they've chosen to be vaccinated. So we've been out there. We have the Protect Michigan Commission, who's certainly working with community groups to make sure the right and accurate information is out in the community. But we continue to do that good work. I think the recent approval of the full approval of the Pfizer vaccine is an important step forward as well, so that people can really be assured that these vaccines are safe and effective, because they are.
Do you think, especially as we get to some of these cooler months, do you think that there could be the possibility of MDHHS orders or restrictions? Do you think that there could be more MDHHS orders or restrictions like we saw in the last year?
Well, we certainly throughout the pandemic have always been flexible and nimble. We've always watched the data, making sure we're protecting our most vulnerable. And so we will continue to do that. That has been how we've operated throughout the entire pandemic.
So not off the table at this point is what you're saying.
I know the law is still on the books, the public health code, but we will continue to monitor the data as we have been throughout the pandemic.
Gotcha. Would you like to see all schools implement a mask order for this upcoming school year?
Yes, as is in our MDHHS guidance, we have put in our guidance that schools should mandate masks. And so, yes, that is what I support.
Do you think that the state is going to recommend booster shots for everybody, or how is that going to be handled, when we get to that point?
Sure, we are certainly awaiting the CDC and the ACIP guidance, but when that guidance does come out, we will be ready to follow that guidance and offer vaccines to those who are eligible.
What do you see as being the biggest challenge right now in fighting this pandemic, especially as we're seeing this surge at the moment due to the Delta variant?
And a lot of this is going to have to be her last question. I know she's got another thing. Okay.
I think the most important thing is for everyone to get vaccinated. I think that's going to be our way to end this pandemic, is to get as many people vaccinated as possible, as quickly as possible. And so that is certainly what we are focusing on at MDHHS as well.